Hello, praise the Lord. Welcome to my YouTube channel. It's me, Kendisha Caroline, and we are back and we have a guest here and she's going to talk about herself, her profession, what she does. Today it's a medical talk. You'll get to know that in detail. So, Dr. Josephine, welcome to my show. Welcome.
Yes. Thank you for hosting me. I'm happy to be here. And my name is Josephine, like you have said, Josephine Likichoru. And the other name is Senyonga. My husband is called Senyonga.
Okay.
Yes.
So you're married?
I'm married, yes.
Okay.
Yeah.
So Dr. Josephine, can you tell us where you work? What is your profession? Because you're saying doctor.
Yeah, so if you like, you can call me a doctor of the ears. In medicine, there are many branches of what we do. So we specialize in hearing. That means that if you don't hear well, you come to us, we check, and then we're able to give you the solution to the problem. So that's what I do. I work in Mulago Hospital and a clinic called Kampala Audiology and Speech Center. That's what I do.
Okay, so you told us you're married.
Yes, I am.
Okay. So many people will be saying like, Todenga is different.
Oh, really?
Yeah. Are you a Christian born again or?
Yes, I am. And I go to Horimo. Okay, Horimo is my church. And I just joined Horimo. Is it? This is the third year. The third year, I think. Yeah, during COVID time, and we used not to go to church, so we would just Google things, go on YouTube. So my husband and I found Horimo.
So you were in another church, or you were just staying home?
Been to many churches.
Can you tell us a little background? Some churches, maybe one of the churches you went
One of them, okay, for the longest time I was in Watoto Church. I was actually in Watoto Church before the branches came. And so we used to be in Watoto Church downtown. I sang in the choir, all the Christmas cantatas, I sang them. And until I left. But during that time, of course, we used to visit churches. Another church up there is called at Lumumba Avenue. We used to go there on Saturdays. We used to go to Mutundwe.
So I've been to various
all over the place, my friend.
So you talked about your husband was on YouTube.
Yes, of course, all of us used to look, but we found Sister Linda's testimony
on YouTube.
I started following. He said, check this, and I listened to it, and I said, oh my God, I started listening again and again. And for him, he likes researching. He researched until finally he discovered that there was Horimo in Uganda.
Wow.
Yeah, so he had to physically go and look for the church. The first day, I think he failed to get the place. Then he went again, and then he found the place. He went in the morning, and they said, no, these people, they come in the afternoon for their service. And he was like, how? But that's long story short, we found Horimo Uganda, and we joined together, thank God, because I found that it's difficult if the wife joins and the husband doesn't join. It's a bit difficult, but we agreed to join Horimo, and we've been there this time. We thank God for finding it.
Yeah, maybe people will be asking, Horimo Uganda, where is it located? Your name church?
Yes. Fine. Horimo is there. There are so many people who are on YouTube actually. They know Sister Linda's testimony. They know Pastor Porika's sermons, and they like them. They've been following online, but they don't know that there's Horimo Uganda. Here we have a church in Lugala. Lugala, if you see Kasubi Tombs, you go up like this, you find it somewhere there. Yeah, so it's in Lugala, and we have weekly services. We have also Sunday. So if they come, they'll be able to find what maybe if they can contact you also, because you're on YouTube.
Yes, they can contact us, because many people have been on my show and many people be like, I'm from Horimo. So today we have a medical person is going to be telling us about her profession. It's about hearing. Yes. So can you tell us about maybe what is it a problem in Uganda? Is it a big problem to be deaf? You can talk about that.
Yeah. So, like I said, it's you know, in hospital we have the branch of medicine called ear, nose, and throat. But ear, so we are dealing with the ear, but also particularly hearing. So there are many people who have hearing problems. First of all, a child can be born deaf.
What could be the cause at birth?
At birth, before you're born, something can happen during pregnancy. That's why we tell you go for antenatal. Some of those things can be identified by doctors, and they're able to solve it before the child is born. And some mothers, pregnant mothers, take medications which are not supposed to take because you just go to the pharmacy, buy medicine, and you take, and then it affects the child. And also there's some problems that run in the family. Maybe the grandfather,
genetical.
Yes. So they maybe the cousins are having the problem, uncles, and the child will also have. So there are many problems that can happen before the child is born. But there are also situations that happen during the time of birth. People who deliver from home, the child lost oxygen. There are so many accidents which happen. That's why we tell them rush to hospital. And if your child is born in hospital, some of those things can be avoided. And then sometimes children are born premature. They have issues with their ears, and children they're too small for that time. They are born when they're too small, and also immediately they are born, there are some diseases they can get. They can get infections. Those infections can also affect their hearing. They can affect the ears. Also the treatments that are given. Some antibiotics, strong antibiotics, can cause hearing problems.
So there is getting deaf at birth. What other cause? Someone can be hearing, then after some time the person one ear is not hearing.
Yes, it can be sometimes infections. Sometimes infections can cause that. But there are other causes, like you know,
I had someone in the village say that my son had cough.
Yes, that's right. That's right. Because cough, the nose, the throat, and the ear are connected. So if you have a blockage in the nose because of flu, or you have cough, all that is connected. So you can have the effect in the ear. Sometimes children have pus coming out of their ears. You see that? That is from the flu to the ear, and then the ear, there's what we call the eardrum. It gets ruptured, there will be a hole. So the pus is coming out. That means that you're not going to be hearing well until the treatment for that problem is done very well. You have to see the correct doctor.
Yes. Like there's people who get problem with the ear and they're like, go and buy the ear.
Yes, indeed. So the doctor has to see what problem is it, which medicine do you need. It's not just a matter of applying medicine. Okay, so those are the things. So there's so many problems that cause even just wax, accumulated wax. You know, wax accumulates in the ear and it blocks your ear.
Yes. But
the problem is wax is a natural thing. God created our ears. The wax is good for our ears. It protects the ear. But if it's too much, then it blocks the ear. But who removes the wax? Not you. Not you, it's the doctors.
So
the ear doctor, you have to come. And your ear naturally is not dirty. People keep cleaning their ears in pain. That is wrong. It's very wrong, and we don't allow that. So if you feel anything in your ears, look for an ear doctor or go to any clinic. They will tell you what to do next. So what would be the symptoms and the signs that maybe I have an ear problem, maybe I'm losing I'm not hearing? What would be someone to rush to the doctor? Okay, so first of all, sometimes you can have pain. Or you can also have some ringing sounds like amalagozi gowulira naye nga tegali outside naye ogawulira mu matu. Some people have that. They give me quinine and I'm hearing something in my ear. Quinine does that sometimes. I told you some medicine is called that. So while my name and other people are not hearing them, it's your alarm. Are you hearing that sound? But they're not hearing it. That's one symptom that you have an ear problem. Another symptom is that you shout, you think people are not hearing you. That is one symptom. You don't hear yourself. So you shout. So if your child shouts, this child may not be hearing you. If you send a child for a cup, naye ekikopo naleetayo sabbuuni oba ekirala aba tategere tawulidde ky'omugambye. So the children, people beat up children. This child is very stubborn. naye omwana ayinza okuba nga takuulira. So that's another thing. If a child is not doing well in school, or the teacher says this child is stubborn, we tell others to do it, they do, but this one doesn't do. Maybe the child is not hearing well. So those are some of the things you can know. Oh, this person, for even adults, there are people who shout, but he's not hearing himself.
That is a sign.
Yes, that's one of the
There is someone, it's like, someone like was narrating to me that her mom slapped her and she lost. So I was like, maybe was it the eardrum near or what? She lost her. She uses one ear. So even
it's possible.
Okay.
It's possible. If you get a slap, it's you trap pressure in the ear. It's a hole which leads to the eardrum. So once you get a slap, you get the eardrum tears.
Okay.
You apply a lot of pressure. In school, they were doing, they were beating children, slapping husbands, slapping wives. Can you imagine? So you can get that, and she's right, it happens, and we've seen many. Yeah, you can get it.
So that is one of the symptoms.
Yeah.
So those who are totally deaf at birth, can they get treatment and recover their like hearing sight? Hearing. Can they recover?
So what happens is that at birth, we're supposed to do some tests. Of course, in Uganda, we're not yet very good at doing or testing all babies before they leave hospital, but we are supposed to do a test to see is the child okay or not. So if the child has a problem, we follow them up.
Okay.
So in a few months, a child should be helped before 3 years, because that's the time when your brain receives sound, and that's when gamble. A mama means money.
And when you call the child's name,
Tan. His name is the hearing it. So we want them to do it early in life, before 3 years. So if the child we check you and you're not hearing at all. Before, we used to just send you learn sign language. Go to school for the deaf. We have schools around. But now there are other options. You can, there's what we call cochlear implant. They do a surgery. The part which is not working can be replaced.
Okay.
They're doing that. So if you can hear a bit, if you shout, the person can hear. Those ones, we give them what we call hearing aid. Akuma akuongeza sound.
Because I've seen one of, I thought maybe it's fashion at first, and I was one.
Yes, so it has a small microphone. So when you talk, someone is like,
so it traps the sound.
It traps the sound and makes it louder. If I'm talking at this level, it makes it louder. So this person is able to hear. So they are called hearing aids. You put it on your ear, like how you put on glasses to see. The hearing aid makes sound loud. So you can hear.
Yes, so it is treatable.
It is. There are many treatments. Sometimes the treatment is medical. If you have an infection, the doctor will give you medicine, antibiotics, and it will go.
Okay.
But some of the hearing problems are permanent. Once they happen, you cannot reverse them. You can only do what you can do with hearing aids and stuff like that.
Okay. So another thing, Dr. Josephine, you talked about these people who have at old age, those people they reach at old age, can they also recover their hearing, or when someone becomes old, even some lose their, they don't hear properly?
Okay, so what happens is that when you're growing old, most of the cells keep dying.
Okay.
The eyes, ears, some brain cells, you forget things. So most of the people, their hearing keeps going down over the years. So that's one of the types I was telling you that is permanent. You want it happens, it goes slowly. It goes slowly. After 2 years, after 4 years, so what happens is that's the kind of person we give hearing aids to make sounds louder.
Okay.
They can be able to hear, but you cannot remove the problem. No.
Okay.
Yeah.
So for you talked about how can we. So you talked about we're not supposed to clean our ears. So how can we keep our ears clean?
The ears are clean. God is very, very, very wise.
Actually, there are some people you see their ears some
Yeah, so what happens? That wax I was telling you is what you people call that. It's not that. It's part of the ear. It traps the dust. It's formed in the outer part of the ear, so it comes out. Very tiny particles come out. You may not notice. But so if you try cleaning, you push it where it's not supposed to be. It will accumulate there and become hard. And then you have to come and we remove it. And yet it's God made it in such a way that it comes out by itself. So it's not that. It's supposed to trap that like dust. Even when an insect enters your ear, it struggles to reach far because the wax is there. So as a little bit of wax is good for all of us. So your ear has to be having wax. That is not in your ear. You know?
So these people who use ear pads, so pens to clean their ears.
The problem is some people have allergy, like the ear is itchy. You cannot prevent them from doing that, but it's the wrong thing to do. Many accidents happen, and those earbuds, see on it, it's written don't don't put inside the ear. Yes, they can actually clean outside. So sometimes they use for cleaning inside the baby's nose. Don't put it. It's written there. It's like, for us we have written. If you don't read on it, and
for us you don't read, we just
so it's not a good thing. But the problem we have is that people don't go to the doctors to check. Hey doctor, look at my ear. I have a blockage. I have pain. I have this. Check with the doctor before treating yourself. We know too much. We know too much these days. We know medicine. You go and buy your medicine. So that's what you can do. Go to the clinic.
Yeah, you go to the clinic. Yeah. So you're not supposed to go for your own personal treatment.
No.
Those people say that my ear has a problem and they go and buy ear drops.
Wrong. Because there are different ear drops for different things. So some of them are not good. Some of them we don't recommend. So there are many hospitals. Mulago Hospital is free. You can come. Yes, the ear clinic is free. Or most of the services are free, so you can come.
So if you're out there having hearing problem, you can come. Maybe you can eat services around here or location, or they have to go to Mulago.
We have a private clinic.
Yes.
But also Mulago, like I said, is for free. Of course, in some places you go and you get this service, but the other one is not there, so you will. But the doctors in Mulago will assess you and tell you what the problem is. They are experts in what they do, so you're better off doing that. But other places, there are many private hospitals, clinics who do things.
So here,
so this is Kampala Audiology and Speech Center. It's on a Sami building. The Sami is on Bombo Road, just next to City Oil and Petrol. But here we do, so most of our patients come from the ear doctors. They send us, say, please do the assessment and see how bad is this problem. So after assessment, we will be able to know what treatment you need. Are you going to have cochlear implant? Are you going to have a hearing aid? Are you going back to the doctor for medicine? So we're able to know that.
So what are the things that can cause someone to have that hearing problem? Like that can cause deafness, because we have some people have earphones, and you put your earphones in the phone and the phone will tell like, this is too much for your ear. Some of the things that may bring deafness.
So true. One of them is like what you have said, noise. Loud sound causes deafness, and it's permanent problem. It's permanent. You cannot reverse it. And like people who work in factories that have noise all the time, you can have hearing loss. People who go like loud music, discos and things like that also can cause hearing problems. You may have, like we talked about children, but you may have adults who also get some serious infections, meningitis, some infections that affect your body and go up to the brain. Even malaria itself can go to the brain. You remember cerebral malaria we used to talk about? Most of the things that affect you, meningitis. There's a disease called mumps, where
it does affect the
mumps causes, it's a viral infection. It also causes serious hearing problems. There's one disease that I want to talk about. It's it's called German measles. Now it affects the mother. It's like a small rash of measles when you're pregnant. And if you don't deal with it, it will cause the child to come out deaf. Not hearing anything.
But it was just a rash.
Just the mother even ignored it. But if you didn't go to a doctor and say, hey, but enough rash, then it has gone. It's not affected you so badly, but it has affected the child. So there are so many infections. You won't know them until you go to the doctor. The doctor will ask you, did you have a rash? Did you have this? Because you don't know. Yeah. So also, like we talked about age, when you're growing old, your hearing will keep going down. Recently, we get people who have fallen off border. If you hit your head, this part, you also become deaf.
Okay.
Yes. You become deaf. Your ears won't hear because the nerve may be damaged. So border is another this, which causes
like an accident.
Any accident where you hit your head.
Okay.
Yes.
Okay. So as you're coming to the end of the show, can you tell them just a brief little words about your profession and telling the people who have hearing problem they could come and you assist them? Yes. So anyone who feels like either their child or their spouse or themselves still not to be normal on your ear. I think I don't feel normal. I feel sounds in my ears. I feel I can't hear well, and stuff like pain and things like that. Please come, we'll check. You don't just treat yourself because you may worsen the problem. Yes, and mothers must do antenatal and deliver from hospital, please. Yes. Like they should be under guidance, supervision before giving birth. Yes. Okay. Thank you so much. It was a brief medical talk. Till next time. Bye.